Hello, and welcome to The Skin You're In, the show where we empower you to make decisions about aesthetic treatments. Joining me today is a new friend of mine, Kara Whitman. She and I did not know each other before this interview, and I was really grateful to her for being willing to just come in and talk about her experience. Obviously, my own experience is kind of limited to myself and the treatment that I give other patients. So I was really interested to hear from somebody who had not had treatment from me, but had had treatment from someone else. In this episode, she's going to talk about what it was like for her when she first sought out treatment, her kind of experience having her first treatment, and then wanting a little bit more conservative and now feeling like, oh, maybe I want a little more again, and how she experienced that. I hope this is helpful and enjoyable for you. Please give it a like and follow for more. Hi, how are you?
I'm good, how are you?
Good. Thank you for being here. You and I don't know each other. So this is exciting because I like talking to new people and hearing what your experience was. So will you tell us about yourself?
Sure. So my name's Kara, and I'm a paralegal. I work at a law firm in Nashville. We do criminal law and family law, and pretty simple lifestyle. I just, enjoy my family and friends, and, I like to run and just little hobbies here and there, but
That's great. Now, when did you first start thinking about having treatment in like aesthetics, either toxin or filler or anything?
It was in 2020. My first treatment was right before COVID, and a friend had it done recently and loved it, and she said I need to try it out. So I did, and here I am.
Did you have any like apprehensions? Like, I don't know.
I was nervous. I wasn't really sure what to expect. I didn't know if I was going to look different, but it was fine. It went smooth. I waited longer in the waiting room than the actual appointment.
Yeah.
It was super quick. And I loved it.
That's great. Did it help having a friend that was like, had done it first?
Yes, because I was able to ask her questions like, did it hurt? What did it feel like? And I mean, it couldn't have been a simpler process.
Yeah, that's great. And were you with the first person you saw was a plastic surgeon, right?
Correct, yes.
Did you know him before?
I did not.
Or her,
No.
him or her?
No, I did not know him. It was my friend that had went there and referred me there.
Right. Okay.
Yeah.
And how was your experience there?
It was great. I mean, he was very nice. I was, trying to be a little more conservative since it was my first time. But he was ready to like do my whole face, like whatever I needed, he was willing to do. And I just wanted my forehead at that point. I just was a little nervous. So
sure.
Yeah.
And what was that procedure like for you that day? You said it was like pretty painless.
Oh yeah. It was just a little pinch, and kind of like a weird crunching noise. It was kind of bizarre.
Yeah.
But before you know it was over.
Yeah.
And it was great.
And so how long did your first treatment take to kick in?
I want to say it was probably 10 days or so.
Okay.
I didn't see it right away.
Yeah.
And he had said, to put like a cold compress when I got home. Don't do any exercise. Like he was, I followed all the instructions. And I was able 10 days.
Okay. And what did you see in 10 days? Were you like blown away or were you pleasantly surprised or?
No, it was great. Like I had no wrinkles on my forehead. If I lifted my brows, it was great. I loved it.
Yeah.
So
then you decided to go to a different provider after that, right? Well, COVID hit.
Yep, COVID hit, right? And then I ran into a friend who was opening up a med spa, and then I started going there.
Yeah. And how's that been?
It's great.
What are some of the ththings that you like about your provider?
I mean,
You
I like
knew her before.
Yes.
Yeah.
I knew her before. I obviously trusted her because I knew her. She's super flexible with, getting me in. She's also conservative too, where she doesn't, give me a ton and then I end up like looking like I'm frozen. And it's just, it's a smooth process. It's, relatively close to my house, and I enjoy going there and catching up, every 3 or 4 months.
Cool.
Yeah,
that's great. Probably having known the person makes a huge difference.
A little easier, yes.
Yeah.
Mm-hmm.
Have you noticed, so this is kind of a tough question and people are like, I don't know, but have you, like, can you describe any way that you have changed or your life has changed since you started having treatment?
I'd say the only thing I'd say is changed is I feel like I look better when I have it. Like, as it wears off and I don't have it, I feel like I can see the aging process. Where when it's working, I feel like it looks better.
Yeah.
I would say that would probably be the only thing that's really changed. So, hence the reason why I would, keep doing it and want to get more.
Does looking better change anything else for you, like how you feel?
Yeah, I mean, you always feel, when you feel like you look better, you feel better. I mean, I know that's probably not really the right thing, to...
but... Well, what do you think about that? Do you think it's bad to want to look great?
No, but, I mean, I know looks aren't everything,
Yeah.
But, it is important to, feel good about yourself. And,
absolutely.
I think it kind of gives us a little more, like, boost in our confidence.
Yeah.
Because, I mean, as we get older, we start seeing more wrinkles and aches and pains. And
do you feel like that affects you at work at all, like the confidence level?
No, I don't think so. I mean, I do have a lot of, client contact, but I don't really think it affects. I would say no.
Yeah, you're good. You're a confident lady then to start with.
Sometimes. Depends.
Now, have you ever had any other treatments besides wrinkle relaxers or botulinum toxins?
No.
Have you thought about that?
Yeah, I have. I've thought about some of, like, the fillers, like, around, like, the lines.
Uh-huh.
But I haven't actually looked into it. Like, I just kind of think about it.
Yeah.
Maybe some point.
What are the things that are holding you back?
I don't know if there's really anything holding me back. I just haven't actually done it.
Yeah.
But it is something I would definitely consider doing.
Does your friend do fillers?
Yes.
Oh, okay.
Yeah, they do all kinds of treatments there, and they do those threads.
Oh, okay.
Whatever, I forget what they're called.
Threads, yeah.
Yeah, and the facials and all of that.
Cool.
But I haven't done any of that there. Just
yeah. Now, do you notice that your makeup sits different when your toxin is working versus when it's not working? Do you do your makeup differently at all?
I don't think so. No. I never thought about that. I don't think so.
One of the reasons that I started wanting to have my wrinkles dealt with is because the makeup would just gather in the lines.
Oh.
It clumped.
I never noticed. I mean, I don't wear liquid foundation or anything, just like a powder. So no, I actually haven't noticed.
Yeah.
I'll have to pay attention to that. I
hate wearing makeup for probably that reason.
I do too.
I'm I feel like I look worse.
Well, if I don't wear it, somebody always asks me, "Are you not feeling well today?" Or if I don't have lipstick, somebody always asks me if I'm not feeling well.
You're like, gee, thanks.
Yeah, exactly.
Gee, thanks, dude. Yeah. So what advice would you give somebody who is thinking or on the fence about having any treatments?
I would say do it.
Yeah, that's your advice, is do it?
Because you'll love it.
Yeah.
And I wish I had done it sooner. It's
really?
One of those things. Yeah. Just because, I mean, I think the sooner you get it, the less wrinkles are going to show. And obviously you don't want the deep lines because that's what you're trying to avoid.
Yeah.
But I think once you get it, you have to keep getting it because you like the results.
Yeah.
So.
Have you ever gone a period of time and not been able to have retreatment on a schedule or whatever and it wore off completely?
Yes. Yeah. A couple times.
Now, I think a lot of people worry if I get it and then I don't get it or I take a break or something bad was going to happen. What did you notice? What do you notice in those periods where you go without treatment?
I just notice, the wrinkles in my forehead. If I or when I raise my brows, you can see the lines where when I have it, you don't. But I don't. Other than that, it's just appearance.
They're not those lines aren't any worse than if you hadn't had treatment to begin with, right?
No.
Yeah.
No, not at all.
You just start moving again.
Yeah, exactly.
And then once you do get treatment, let's say you're busy and you're not able to get in for treatment, once you do get treatment, does the treatment work the same way?
Yes.
That it did before?
Mm-hmm. Yep. It pretty consistently is about 10 days or so. Sometimes a full 14 before it works completely. Or I'll see one side work a little sooner than the other. But then eventually the whole thing works, which is great.
Yeah. Do you do a lot of Zoom calls or anything with your work?
I don't.
Are you looking at yourself? It's funny, like, I never really noticed, you take pictures and you see yourself in pictures, but once you start looking at yourself in video, everything changes.
You're like, look different.
Wow, it's so different.
Right. I think pictures too, though, because you see like, oh, that eyebrow looks a little higher than that one.
Yeah.
And, like, you start picking yourself apart. Yeah. Well, I know I do anyways, but.
And asymmetry is so, basically not so common. It's literally everyone has asymmetry.
I know.
And you don't recognize it.
Right. Only on yourself you notice it.
Yeah.
Or me anyway.
But you don't, like, I never noticed, only in watching myself in videos do I notice that I talk out of the left side of my mouth. Like, the left side of my mouth is always, like, pulled over more.
Oh, that's funny. That's interesting.
Yeah, so I don't know. I haven't noticed it yet, but I'm assuming that down the line, if I, maybe not since I have treatment, but, like, this side is going to be worse than this side. Because I'm always, like, talking out of this side. Also, my eyebrows are totally asymmetric. Like, just my facial expressions are totally asymmetric. It's so funny.
Yeah, it is. And everybody's are different.
Yeah.
Their brow shapes, like everything.
Yes.
So it's kind of like it's not like a one size fits all, which I'm sure you see that when you're doing the treatments.
Yeah.
Everybody's different. So.
Now, have you ever had to kind of tweak things with because you've been having treatment now for like 2 full years.
2 years, yeah.
So has it been like the same treatment every time, or do you try different things?
Well, the first time I had it, he used more units than we've been doing. And we have tried a couple, different brands to see if, one would last longer than the other. But aside from that, no, it's just been pretty consistent with the amount of units. Mm-hmm. So.
And you get the same pattern every time?
I believe so.
When you were first, so let's say when you first started going to the person that you see now, was your very first treatment like just right for you, or did you need to tweak things after that very first treatment to figure out what was just right for you?
Actually, I did go back about 3 weeks later, and she added a few more.
Okay.
And I think that's, because I was like on the conservative side where I, I told her I didn't, want to be completely, frozen, and how my first time I was, which now looking back, it's not bad, but, so yeah, and I did end up going back, and she did add a little bit more.
Okay.
So now it's just been pretty consistent.
Nice. Yeah. So that very first experience with a provider, you're kind of like figuring it out. And then after that, you kind of get on a roll, and things are the same way every time.
Yeah.
So that's funny. The very first treatment you had, you were like a little more frozen than you wanted to be. Mm-hmm. So you went to a different provider just because you knew her and was like, I want a little less. And how do you feel about it now? Looking back, and like, do you feel differently about it now?
I do. Only because I like the results, and I want it to last longer and get the most out of it. So, being frozen for just... it's not even frozen. I mean, you still move your face. You can still, have expression. It's just not like when you don't have it, you know?
Yeah.
So I guess that's kind of a weird term to use, but
I know it has kind of a negative connotation.
Right. Frozen. It makes you feel like, like you're walking in a wind tunnel, like your face is frozen. It's not. But yeah, I do. Because now, of course, I like the results, so I want more.
Yeah.
Where before I wasn't sure, and I was wanting a little more movement.
Yes.
Where now I'd rather not have it, because that's what I want to avoid.
Yeah, and towards the end of a treatment, so like you get treatment how often?
I mean, I technically probably could go like every 3 to 4 months, but I'd spread it out a little more. We usually do like 4 to 5 months.
Okay. And so towards the end of toward maybe the 3-month mark, you start gradually getting movement back, right? Mm-hmm. And so has your provider explained to you that if you get a higher dose at the first time, it will increase the duration. It will last longer. Right. Yeah. Now, of course, that does increase the cost.
Right.
Of it.
And that's the other thing I was going to say. It's either you pay that all up front, or you spread it out and then you go
often.
right.
Yeah.
Exactly.
Yeah.
So I guess it kind of works out to the same essentially. It's just a matter of, preference. So, yeah.
And how do you handle the financial aspect kind of mentally? Because I feel like a lot of women have a hard time with the idea that I'm going to spend money on like my wrinkles.
Yeah. Well, I mean, it is a lot, but our skin obviously is an investment. We've got to take care of it. And I think as we get older, we really start seeing that more, with, sunblock and, facial care regimens where, when I was younger, I didn't do that stuff. Now it's important. So I think, it's something that you definitely have to put money into. And for me, it's for me, you've got to take care of yourself and you've got to feel good. And if that's what you have to do, and it's not like it's going to break the bank. I mean, you can definitely budget. It's not like, it's thousands of dollars.
Well, have you ever heard of the, oh gosh, I can't remember the name of it, but have you heard that historically speaking, during the Great Depression, sales of lipstick actually increased? Did you know that?
No, that's funny.
Yeah, they might call it like the lipstick effect or something, but it's that like even in times of great difficulty, people really value the way that looking good makes them feel.
Right.
And it matters even when times are tough, or it might matter even more when times are tough, because like it
probably
gets you up and going and doing what you got to do. And
that's true. That is true. I didn't know that though.
Yeah, there's been multiple examples of it throughout history, but I think in like between 1900 and like between the Great Depression and the world wars, like lipstick sales increased during times of difficulty, which is funny.
It does make sense though.
Yeah. Now, does anyone in your life have any thoughts about the fact that you're getting Botox?
Well, my boyfriend doesn't think I need it. He says, "Don't mess with your face. You don't need to do anything."
Of course, but he has to say that,
right? Well, but if I didn't tell him, he probably wouldn't know either.
Yeah,
because it's really not that big of a difference. I don't think people would notice.
Yeah,
that didn't know me. They'd be like, "Oh, her forehead's not moving." No, I was like, "That's not how it goes."
Yeah.
So, but he's the only one.
Yeah.
And I mean, that's also because guys are simple. He gets his haircut for $20 every couple weeks. Where we go, it's a couple hundred. It's a little different.
Yeah.
So,
yes, exactly.
I just tune it out.
Yeah,
it's fine.
Good for you. Tune it out. That's fantastic. Well, thank you so much for giving me a little of your time today. I really appreciate it.
Yeah, thank you for having me. It was great chatting.
Do you have any advice for somebody looking for a provider? Because you knew the person that you see,
right? And
you had a recommendation for the very first person that you saw, right? But if you nobody had told you where to go, and you were like Googling this, what would you be looking for? Do you know?
Well, I'm always one for kind of like referrals, because I always feel like that's the best way to actually like know what you're getting into. But if I were Googling, I would probably just, I'd be looking for somebody that, this is what they do for work. Obviously it's a medical background. You have to do that anyways. What they offer for services. And then, once you talk to them and meet them to see if it meets your needs. You don't want somebody that is trying to sell you everything. You want somebody that's, really wants you to look good and, basically just give you what you want, but with advice, So I would say that, it's kind of hard to, when you go online and look, because I feel like everybody kind of puts their best front out there. So you really have to, meet them or kind of word of mouth.
I like that idea though. And I say that a lot too. If people are like, who should I go to? I'm like, well, first of all, go and meet the person and don't commit to having treatment until after you've had the chance to talk to them. Right. Just because you're in the room doesn't mean you have to have a needle in your face.
And they should do a consultation, first anyways, to see if it's something you want to do, or especially if it's a first time.
Yeah.
So yeah, it's definitely a big decision because you want to walk out of there happy,
It's your face.
It's your face after all, right? It does wear off, so it's not like it's permanent, but you want to be happy with it if you're paying for it. And yeah.
Well, thank you so much.
Thank you.
It's a very vulnerable position to be in, to admit that you get treatment.
Oh, not at all. I'm happy to admit it.
Do you send all your friends to all your coworkers to?
I mean, people that ask, I tell them that's where I go.
I also feel like the way that medical aesthetics is going is it's gonna kind of be like your hairdresser, like. It's going to be a very geographically local service. Like, I really see myself as serving like the Amherst community.
Yeah.
And obviously I have patients that come from further out, but there are providers all over the place.
Right. But I feel like once you get to know them and they know you and they know what you like and how, you know that they're not going to, want all this crazy stuff done.
Yeah.
And I think that's important too, so you kind of just build up that relationship. When they come in, you know what they want, and if you need to tweak it a little, you can. It's not like meeting somebody new every time.
Yes.
So,
yeah.
But yeah,
providers definitely do have a vibe too, which
absolutely.
I feel like you can get. Which that's kind of why I try to put a lot out on social media and so that people can see what my vibe is and decide
absolutely.
if it's a good fit, because I'm not for everyone, for sure. Everyone's not for. Like, there's not the one right provider that's going to meet everyone's needs, so.
True. But you're pretty awesome. So. I'd be a fool not to come see you.
Oh, thank you. You're so sweet. Well, thank you, and happy Thanksgiving.
Thank you. Same to you.
I hope you enjoyed today's episode. If you are interested in coming onto the show, either as a provider or a patient, I would love to have you. Please reach out with any topic ideas as well. I'd love to hear them all. So like and follow and comment your ideas.